now also like to invite an exciting lineup of speakers who are shaping the future of healthcare through innovation, policy, and cutting-edge technology. Please welcome Dr. Shyama Nagarajan, serial entrepreneur with over 32 years of experience across public health and corporate healthcare and multilateral agencies in South Asia. She is currently the Executive Director of Make in India Healthcare Private Limited, a novel, innovative initiative of AMTZ. May I invite Dr. Shyama Nagarajan onto the stage, please. Joining her, she'll be speaking on innovations from India, tech, touch, and trust. Joining her is Dr. Rajendra Pratap Gupta, founder and chairman of Health Parliament and Chair Emeritus of the Center for Health Innovation, Policy and Digital Health, Indian Institute of Management, Raipur. He will be addressing impact on healthcare, functional AI pyramid. We also have Mr. Manish Goel, Chief Operating Officer at Mayo Clinic Platform, a leader at the forefront of integrating AI into one of the world's most trusted healthcare institutions. He will be sharing his insights on Mayo's clinic experience on AI transformation in healthcare. I request all the speakers and moderators to kindly take on the session ahead. Thank you.
Good afternoon, everyone. Thank you so much for joining this session. Today we are discussing one subject, that health tech and innovation, which is already we had spoken a lot. Particularly, more we discuss this subject during this year, and the more on post-COVID situation. By that time, we could understand what technology, health technology and the innovation, and how we could navigate the situation during this very, very drastic situation. Now, each and every forum we talk about this health tech and innovation, but here in this panel of speakers, you will find something new, some future trend the team is going to discuss with us. If you see this is a healthcare globally, it is in an inflection point. Technology is no longer an enabler. It's a driving strategy actually. Absolutely it is a strategy driver. As of today, the way we are delivering healthcare. It is becoming a backbone of healthcare system. Right from AI-assisted diagnostics to remote monitoring and automation of hospital processes, systems. And innovation is really redefining three parts. That's efficiency, quality, and of course, what is the outcome? It's the patient experience. But here today, all the healthcare leaders present here in this discussion or in this forum, the major issue is that whether this technology will transform the healthcare, it is not the discussion. The discussion is how fast we can adapt it, but more precisely, meaningfully, and responsibly. So this is the discussion today. We'll go through. We have very renowned speakers with us. Before I would like to go further, I would like to give to my co-chair, Mr. Ganesan from Kauvery Hospital, for an initial introduction, please.
adding on to what Rupak sir said, I think we are at an inflection point for technology in healthcare. Lot of push from the government, technology disruption, namely AI, and a new workforce which has an appetite for technology. I think we have a convergence that is happening, and that is probably a holy grail moment for technology to really catch up in healthcare. I mean, I've been in this business for about 4 years, and I see this whole landscape transforming in terms of the appetite and adoption of technology. So I think I'll give it to the experts on this forum to really just talk more about technology. We'll start with Rajendra sir. Rajendra sir, I think there's no better person to set the context or history of adoption of healthcare, technology in healthcare in India than you. You've seen it all growing, and you've probably seen all the failures and all the successes that have come through. So I just wanted you to really shed some light on that and take us through the journey and where we are and how do you see the future shaping your state.
You want the presentation or do you want a conversation? Presentation? Okay, good.
So Dr. Rajendra Gupta is the founder and chairman, Health Parliament Chair Emeritus Center for Health, Innovation, Policy and Digital Health, IIM Raipur. I know Dr. Gupta for last more than 20-25 years, our old friendship. So nice to hear from you, Dr. Gupta.
Can you start with the first slide? It's not the first slide. No, it's still not the first slide. Mavish, can you check that? So before I start, let me ask you while they're setting up the context. How many are awake? Can you raise your hands? I think majority, thank you. How many of you are excited about the potential of AI in healthcare? Can you raise hands? Awesome. Can anyone tell me the 5 levels of AI? So yesterday, Brigadier Pawan Kapoor made a very profound statement about institutional readiness. If we are going to talk about innovation and IT, I think each one of you, whether you are a clinician, whether you are an organization, whether you are running an organization of organizations, you still have to create institutional readiness before it's too late. My talk is all about that. Is it there? Okay. So, people talk about technology and they say that AI is in 2 phases. Sometimes they say it is in toy stage, you can play. Some say it's in deployment stage, you can deploy. But where exactly are we? So, I look at the IQ of our current ChatGPT. This is exactly where it stands today at 155. Einstein was 160. I'm always preponing, the timelines that I give about technology. 2015, I said 10 years, we are exactly there. Then I said 3, 2, now it's 1 and 2 years. I think in next 2 years, our IQ would be 10 times. So you would have an assistant 10 times an IQ of Einstein to work with you. This is my main message to you. And I would suggest instead of photographs, if you focus on the 5 levels of AI, when you deploy one level, what happens and where the displacement happens and who are the beneficiaries. If you understand this, in your hospital, you will know exactly what you will do at the 5th level. So the first is conversational AI, where you implement AI. I give it the name of talkers. Anyone who sits and talks will get replaced. I'm not cutting or mincing any words. I'm saying anyone who sits and talks will get replaced. So effectively, 24/7 helplines, your assistants, your receptionists, but there will be beneficiaries, communication and cost. So an organization, a clinician who is deploying the first level of AI will benefit on the communication and cost. The second is reasoning AI, where it can think and reason and do things. I get the name of thinkers. So some of the medical decision making, some of the allied health professionals, your jobs will be drastically impacted. We have matured at this stage because we have been deploying solutions. I don't talk from a theoretical aspect. Accuracy, diagnostics, and clinical outcomes will be the beneficiaries if you are in a hospital. I don't think you have a choice of whether you will or you will not. You have to make your institution ready for this. Third level is autonomous AI, where it can do things for you. We built this last year and deployed it. You will not get to know whether it was a clinician talking or your boss talking. It can talk on your behalf, get updates, take appointments, do the follow-ups. This was developed last year, deployed, 100% efficient. As an institution, some touch points will get replaced, some procedures, primary care physicians, second opinion referrals. See, I am not diplomatic, I intend to upset you. And I want to make sure that you know that if I don't upset you, you are anyway going to get upset because technology is coming your way. It is the golden partnership between the man and the machine. Efficiency and efficacy are two beneficiaries of this deployment. This is already matured fairly and is being deployed. The next level, which I'm very excited about, it's called Innovator AI, where everything you do today, by 2028, you will not do. That I can assure you. I call it innovators. So, end of 18th century medicine and symptomatic treatment. Today, we treat the same diabetes with giving glimepiride and metformin. When the food eaten by me and you doesn't get broken down the same way, medicines cannot be broken in the same manner. AI will change the very fabric of how we operate the clinician and the patient also and the interface. Quantum computing will get into healthcare because the conventional computing doesn't work. I'm diabetic for 27 years. My doctor told me, get a MODI test done, otherwise I can't treat you. Majority onset of diabetes in young. My data was 6 GB for just one test. Conventional computers can't do that. And with that, I realized metformin doesn't work on me. That's something the doctors have been giving. So I think AI is going to fundamentally change the way you treat. So I would say new clinical pathways, new drugs, new devices, a lot of things will change. A lot of things that you put in a hospital will not be the same. Preemptive care is what will happen. The last level, we are actually building this. So probably when you come to our Global Digital Health Summit, you will see this. We are deploying organizational AI for now. I gave it the name of leaders. So you start with talkers, thinkers, doers, innovators, and leaders. You can run the entire organization with AI. We are actually testing this. We should be able to get this out by the time you come to the summit. So 3-tiered care system will go. You don't need a 3-tiered system. Partly and fully replace healthcare providers. But also, I must say one thing, more diseases are going to come. That we have the tech neck because of using technology, more diseases will come. I'm not worried about that. So not only precision personalized, but predictive precision and personalized medicine. It's called the golden era of medicine. I still believe there's nothing to fear. As clinicians, as patients, as hospitals, it is the golden era of medicine. That's coming. And that's the great reset. Each one of you have to be doing that. Most of the things will move from hospital to hospital, from healthcare to health. It will become health and human-centric. For those of you who don't understand the technology shift, it is more power shifts that you should understand. Over 2,000 years of human history, if you look at, the world has changed from being agriculturally strong to be strong as a country, to being strong in military to be strong as a country. That's how the world has been moving. And then it is trade. That's why you see there are talks happening now to say we should control the resources. It's about trade. But the future is about technology. And this is where I say it is not technology change, it is a civilizational, societal, a cultural change. If any one of you is not becoming technology savvy, you are out of sync with time. And that's where I believe this is institutional readiness as an individual first before your institutional get ready. I'll bring you closer to the disruptive shifts in humanity. Physical labor was replaced in the Industrial Revolution in the 19th century. You can go back and look, it's very recent history. We are all mental laborers here, we don't do physical work. And what is happening is mental labor is getting replaced now. Yeah. Sorry, I think the tech guys have a wrong system out here. So as our tech guys did, they put a wrong presentation. Nevertheless, we have done wrong things, but most of our part is right. I will just get to that and cover that up. Sorry, Dr. Vijay. I said that it was not the right presentation, but this is still the first slide. I said, fair enough. No, go back to the first slide. Yeah, I'll just take to cover the missing slides, but rest all is same. So as I said, this is a great reset and the golden era of medicine, but this next slide for 12 seconds is a very interesting one. I hope audio video is going to work. But yes, how many of you read this paper or know about this paper? Can you raise hands? Just one. Now let me tell you this. This is the paper that is the basis of all the LLMs. So anyone working in AI and saying, I know AI, I do AI, go back and read this paper. But there is a message. I wrote a blog yesterday on LinkedIn. I write artificial intelligence newsletter. This is the paper that led to all LLMs. Everything you see in AI today is thanks to this paper. Attention is all you need. Created by Google, forgotten by Google, picked up by others. So Google lost the race and now they are trying to catch up. Go look up this paper. It's there on the blog I wrote yesterday, Artificial Intelligence Notes. This is a 12-second video and my favorite one since 2019 when it came.
If you zoom out into the future,
no, you're not playing right.
And you ask
I want tech guys to be perfect, please.
Apple's greatest contribution.
Would you play the sound well now? When you're in a tech conference, make sure that you have the best tech. Anyways, sorry about that, but can I move the slides, please? It's not my wish, it's just wasting our time. Yeah.
If you If you zoom out into the future and you look back and you ask the question, what was Apple's greatest contribution to mankind? It will be about health.
Message is clear. All big techs are saying our biggest contribution will be in health. So the message for you is, if you don't get into tech, tech will definitely get into health. And you're going to be replaced. There are no two thoughts. Any big tech is getting into health. I'm going to skip this, but just remember the one who founded Intel had this message. Power of computing changes every 24 months. They forgot it and check where Intel is now. This is something I would still want you to look, the last one. Knowledge is now doubling less than few hours every day. It was 500 years in 16th century and 15th century. The speed at which world is changing is few hours. It's a Buckminster Fuller's knowledge doubling curve. It's a 40-year-old thing. Unfortunately, it is never taught to us, either in management or in schools, should be a basic thing to be taught. I'm going to skip these things because they made it the first slide. It was not. Luckily, it's covered, so it's done. I'm going to move quickly. So in one slide, I will cover what has moved fast. Passive agents to active agents. Technology has moved from deterministic to probabilistic. Generative AI to multimodal AI. Large language models to large multimodal models to large action models. Natural language processing to natural language programming. You don't need to learn coding to do programming anymore. So that's why I say that you got to get ready with it. I am not known to mince words. So I am sure that if you don't use technology, technology will not need you. This I've covered. I'm going to skip this straightforward. I'm going to skip this too. So those who think that if I don't learn technology, my medical practice has been around for 30 years, my hospital has been greatest for 40 years, sorry. Intel used to be on every computer's logo, Intel inside. This is the most powerful, most intelligent company in the world. Last year when I used to make presentation, they had a $1.6 billion loss, later $16.6 billion loss, and their outgoing CEO said, we are not going to be back in competition anytime soon. But this young chap appears. I said that Google forgot the paper, this guy picked it up. This is worth a lot more. So the message is also clear. The old, the big, the mighty doesn't matter. If you're fast enough with technology, you will leave everyone behind. So as a hospital, if you are implementing technology fast, if you're institutionally ready, no matter how new hospital you are, you're going to leave everyone behind. This is a very interesting example of how a 102-year-old company was acquired by a 27-year-old company. Netflix is fully digital, Warner Bros. Is not. So 102-year-old legendary company got acquired, and the best part, what valuation did they get acquired? They got acquired at 15% of the valuation of Netflix. Doesn't matter how old you are, how big a brand you are. Today, technological superiority matters most. When my colleague Manish Goyal delivers his note, you will understand what will drive their technology. So I keep saying in digital age, pride, ignorance and arrogance has the same results. Like Intel, you will go obsolete. The best part in this age, making money and becoming obsolete are almost at the same speed. Depends on what you are doing. If you're using technology, you will make money. If you are not, you'll become obsolete. So I think you'll create phenomenal jobs. So don't worry about it. Just start using technology. What we are doing for you to do that is few things. For hospital founders and CEOs, we run courses for C-suite leaders to get them to be technology savvy, to implement. As in the morning, Dr. Vijay hosted a very interesting meeting where he said, management is the problem, technology is not. Senior leadership doesn't know about technology, so that doesn't get percolated down. That's what we're doing here. Second thing we're doing, when you come to the summit, and CAHO is our partner, you will see the hospital of the future. It's 21st November. When you come to Delhi, you will see hospital of the future, clinician of the future, and pharma of the future. You will see a live example of what hospital of the future is going to be. And those of you want to pick up on newsletter, artificialintelligencenews.org gives you everything free. If people want free, this is the newsletter to subscribe to. It's a wait list, but you will get. And also, there's something disruptive we are going to bring to you before you come to the summit. You can show your interest by logging to digital-chase.health.pulse. This is only for hospitals. People talk about LLMs, people talk about SLMs. This is going to be something that you can leverage in your. So we are not just talking, we are actually developing and giving to you to be ahead and be the world's best. I think I'm going to stop here. Remember, this is the age of creators, not competitors. Don't compete, go on creating. Thank you so much for your time. I appreciate it.
Thank you so much, Dr. Gupta, for your inspirational talk. So Dr. Gupta mentioned about that there are 5 different steps of taking transformation of healthcare system through AI. Also, he talked about a very important message that he had given, that if you are not adaptive technology today, technology will replace you. There is the whole discussion points today. To continue this discussion, I would like to request now Mr. Manish Goyal. He's the Chief Operating Officer of Mayo Clinic platform. Mr. Goyal, please.
Right. Can you hear me? So I'm going to be brief. I'm going to give you the ChatGPT version of my presentation. So first, just for context, Mayo Clinic has been recognized as the #1 hospital system in the world by care quality for 9 years running. And we have been changing Mayo Clinic to be data-centric, leverage AI. Today we have 350 plus algorithms that are operating in all of our clinical areas, whether we get reimbursed for them or not. We believe this is the future, and we're using it every day. And it's all powered by data. 6 years ago, we digitized and brought all of our data into the cloud. Today, it's 36 petabytes of data on 8 million patients. You can see it really is all of the data. And I would say, if I leave you with 3 messages, one is organize your data, have it be clean, have it be curated, and have it be understood by clinicians. Second, we de-identified this data and we made it available to our partners across the globe. And the end results were really powerful. And I'm going to give you a couple of examples, and I just want you to walk away with these examples because it's healthcare. Technology is not here for technology's sake. It is actually to help patients. The first example is looking at a clinical area. So this is heart failure patients. At Mayo Clinic, we have, in those 8 million patients, we have 240,000 patients that have been identified as heart failure patients. I don't need a data scientist to do this. I can do this myself as a business person. But you can see what kind of data we have. We have almost 20 years of patient history and 13 years of pre-diagnosis history. That's necessary if you're going to get to earlier intervention. And then we have almost 9 years of patient history post-diagnosis. That's necessary if you're going to understand what pathways worked well and what didn't. You can see all the multimodal data. So what came out of it is we developed an algorithm looking at ECGs, looking at all of the data, but looking at ECGs specifically. And we're able to asymptomatically, meaning no symptoms that are observed or measured by a clinician, diagnose patients with atrial fibrillation. And I don't have time to go deep into this, but if you actually reconstruct that patient's history and go back in time and look at their ECG, you can actually see we could have diagnosed this patient with this particular condition 5 years before they walked into the office at Mayo Clinic. That means we could have done an earlier intervention. Second example is something a little more complex, looking at glioblastoma, so brain cancer patients. At Mayo Clinic, the survival rate after 5 years is 18%. So it's a very horrible condition that many of you clinicians deal with. But our clinical team knew that certain patients did better. So just looking at the data, no AI, just looking at the data, we were able to say there's certain patients that do better on certain drugs. And within 24 hours of access to this data, our clinical team was able to say there's a particular drug that's used to manage symptoms that patients show a longer survival. So within a week of having access to the data, we actually kicked off a clinical trial. This trial is active right now, and we think it's showing promising results. It's really powerful for those 18% of people, if you think about what I just showed. And now you take that and scale it to the hundreds of companies that are on the planet that are doing some really powerful things, many of them presenting across the hall. And then you take that and make it further. You don't just use North American data, you bring in data sets from around the world. Today we have 4 continents covered, 40% of the top 10 institutions that have all agreed to share their data, all have agreed to make it usable by third parties to develop solutions. And that's how you scale. So I'm going to end with this. It's a quote that really drives who we are as an organization. And I'm going to read this because it's really important. The best interest of patients is the only interest to be considered. And in order that the sick may have the benefit of an advanced knowledge, that's why we're here today, a union of forces is necessary. So if anything I said is interesting to you, gladly, please reach out to me. But our approach is data, organization, clinical use cases, patient centricity, and partnership. Thank you.
Thank you so much, Mr. Manish Goel, we could understand that how Mayo platform actually helping us to scale up the technology and the innovation almost in 158 solution deliverables they have. So it's a remarkable understanding of what Mayo Clinic platform is doing right now. So in continuation to the discussion, I would like to introduce Mrs. Dr. Shyama Nagarajan. Dr. Jitendra Sharma could not join with us today, but Shyama Nagarajan is having almost more than 30 years of experience in this your healthcare transformation journey. She has worked with EY, ICRA, in many of the organizations. Even I had an opportunity to work with her almost 20 years back in an hospital transformative journey. So, Dr. Nagarajan, so stage to you, please.
So, thank you very much. At the outset, we would like to thank CAHOCON, especially Dr. Vijay Agrawal, to have given us this opportunity to be on the stage to talk about the ecosystem. So what I am going to do today is to share with you the story of how an entire health tech ecosystem was conceived and built by a visionary leader, Dr. Jitendra Sharma, and how we have transformed on that today, and how are we going to take this forward. So the story actually starts from finding solutions in a sector that is still not at the level of other mature sector like auto sector or oil and gas. So the health sector was evolving. At that time, what was essential was to understand that how do we make the healthcare ecosystem so vibrant that we are known globally. I will ask you one question here. How many of you have seen Make in India brand in any hospital? We have seen NABH accredited hospital, NQAS accredited hospital. Have we ever seen Make in India branding anywhere? The answer to this is no. Now, if you see a mic, even this particular mic, or a railway bogie today has Make in India branding. But healthcare, that is still not there. Now, why is that so? Have we thought about it? The land is ours, the infrastructure is ours, manpower is ours, but the technology that we have, most of it, over 64,000 crores of equipment that we bring into India is all imported. So even as that we have it, we cannot say it is ours. So therefore, the branding of Make in India does not happen, okay? Now, we as a country, although have proven ourselves to be a nation which is the home for the largest technical and skilled manpower, whether it is nursing or medical manpower or clinical manpower, we have also made ourselves the home for the largest affordable drug provider, pharmaceutical provider for the world. However, in case of technology, we are yet to transcend that journey and be a global player as far as technology is concerned. Now, this journey was actually started in one way to create an ecosystem. Way back in 2018, when Dr. Sharma seeded this idea of creating a tech zone in a 300-acre campus that was pledged by the erstwhile visionary CM. You need visionaries like that, right? You had a visionary CM like the Honorable Chandrababu Naidu Garu, who was there, who talked about having a tech park created and a complete ecosystem to be developed in that. And you had a person like Dr. Sharma to take this entire initiative forward. What has emerged out of it in last 8 years is one of the largest medtech zone in the world, catering to about production of over 15,000 crores of medical devices in a single campus with over 175 manufacturing units and research and development center. At AMTZ, today we produce anything and everything, starting from a glucometer, hemoglobinometer, nitrile gloves, to LINAC, open MRI, and everything that you talk about. Now, and in order to take care of these equipment, we have created a university which produces the first of its kind biomedical engineers who will be looking at the maintenance of these equipment that is produced. Now, you may turn around and ask me that what is in it for me as a hospital owner or a service provider? How am I going to get benefited by this information that you're sharing with me? That is where the next level of the story unravels. What is that? There are three key elements in a hospital if you see. The first thing is infrastructure, the second is equipment, and third is manpower. All these three are equally important as far as a hospital service provision is concerned. When we talk about infrastructure, usually, let's go to the simpler one. When we talk about manpower, most of our clinical teams, that is our clinicians in tier 2, tier 3, everywhere, are able to garner local resources to be able to provide the services that is locally required. However, when it comes to infrastructure, the capital becomes a concern if I want to upgrade or expand my services. Similarly, if I look at equipment, equipment again comes into two different categories. One is that which is low volume, high cost, and the other is high volume, low cost. So the low volume, high cost is the one like MRI machine or CT scanner or things like that, right? For this, you need a capital, you need a financing option, you need some flexible options so that you can have these equipment in place to ensure affordability and accessibility to care. When you talk about high volume and low cost things like glucometer or a hemoglobinometer or a BP apparatus, the challenge in this segment is basically the procurement, supply chain, logistic management solution. So we offer you both these solutions together within the same ecosystem. Now, how do we do it? We have ecosystem partners like Medica Bazaar who can help us to do the entire procurement, supply chain management for all your procurement of all these low-cost items, starting from gloves to nitrile gloves to masks and everything. You don't have to any longer look at multiple GST, multiple negotiations, entire database management. 89 warehouses across the country have been developed so that you don't need to hold inventory within your organization for more than 10 or 15 days, which is a big boon as far as service delivery is concerned. Now, what that helps, it is something similar to the Tamil Nadu Medical Services Corporation that the government of Tamil Nadu has, okay? Now, if you look at the second option, that is high volume, low cost, the AMTZ environment has created partners who will be able to deliver you all these equipment at a flexible financing option without any collaterals. So we have got Medartha Capital, which will be able to do this for you. Now to put it all together, recently what has been conceived is Make in India Healthcare Private Limited, which is going to help you comprehensively take the risk with you. To put in simple terms, if you have a land, you want to expand, you don't know how to do it, we will put the infrastructure, the equipment, hand it over to you to operate. If you have an infrastructure, we will equip it, help you and hand it over to you and expect you to operate. Now, it sounds very simple, very easy. Now, how do we do that? The government with the ecosystem of AMTZ, is able to pledge about 500 CR of corpus to be able to focus on tier 2 and tier 3 city to create such hospitals which can get MII branded going forward, looking at indigenous development of technology within the country. So now what we end up doing is entire system will be able to have a complete ecosystem of service delivery at tier 2, tier 3 city. Now, you want to look at process improvement. We have partners like CAHO, AHPI, who would help you to take it forward in terms of your service level quality. All I am saying is what we expect out of you. There are only 3 things that we expect out of you. Number 1, a commitment to share a plan that you will be able to penetrate the local area as far as service delivery is concerned. 2 is to be able to retain talent and ensure that seamless service is delivered. And 3rd is to uphold the MII brand going forward so that globally we can demonstrate that India is a force worth reckoning today as far as healthcare service delivery is concerned. So we have grounded all these ideas with a proof of concept in Nagpur, which is the Bhanutai Diagnostic Center by Nitin Gadkari ji, and it is a full MII branded diagnostic center today. We are having 2 more coming up. One is Visakhapatnam and other is in Hyderabad. All these are under the same brand. What we have been able to do is to create that entire ecosystem, starting from manufacturing to maintenance to service delivery, and allowing our partners to come on board as operating partners to take this vision forward. What I would like to see today is giving a call to all our hospital owners here that you want to expand, you want to grow, we are there with you to take the risk. Reason is that we understand that there are challenges when you are operating. We are taking the risk with you. We want that commitment coming forth from you that you are with us in this journey. Let us start together. Similarly, I would request all the manufacturing units or financing service providers, do you want to be a part of this journey? This whole CAHO big family with MII and AMTZ can be one of the force that we can actually fulfill the dreams together to bring India onto the national and the international platform to be able to make affordable healthcare delivery through technology put into a one comprehensive ecosystem. Thank you very much.
Thank you so much, Dr. Shyama. We could understand out of Dr. Shyama's deliverables that's how she can handhold and what is the technology and innovation can take place in reshaping the hospital, particularly in tier 3, tier 4 places, how this accessible and affordable healthcare can be built on this technology and innovation. That was a great session today we had, and we could see this year how technology and innovation joining hands together and how this is reshaping the healthcare for future trend. I would like, Ganesan, please give your comments because already time's up, so we can ramp up the session.
Yeah. Thank you to all the speakers for an insightful session. Thank you to Dr. Rajendra Gupta. I think most important aspect of this, taking over this AI journey is the change of attitude, and you emphasized that very clearly as a part of your talk. I think that's a wake-up call that we all needed, and it was a very impactful presentation that you made. Thank you, Mr. Manish. I think we, to grow health tech in India, I think we need to leverage the combined wisdom of what Mayo has for over the years, and it is very generous of you to make this platform available to hospitals in the country where they can co-innovate with you, and along with that, leverage that platform for their own. Thank you, ma'am, for making us aware of the capabilities that we already have in AMTZ and how the medtech system can flourish by using those capabilities. Thank you all for attending and thank you for a very insightful session. Thank you very much.
Thank you so much, all the panelists. Thank you.